respected chairperson, learned audience, distinguished guest, Assalamu alaikum. Before starting my session, I want to express my heartfelt thanks and gratitude to Bangladesh International Cancer Congress for allowing me to stand here. I, Dr. Zannat from BMT Center Clinical Hematology Department, CMH DHAKA, welcome you all on my session overview of first 124 hematopoietic stem cell transplant cases in BMT Center, CMH DHAKA. Hematopoietic stem cell transplant is a procedure that can restore marrow function for patients who have had severe marrow injury or abnormalities of the immune system. Marrow injury can occur because of primary marrow failure, destruction or replacement of marrow by disease or intensive chemical or radiation exposure. The first ever successful transplant was performed by Dr. E. Donald Thomas in late 1950s, for which he was awarded Nobel Prize in 1990. In our country, the first successful bone marrow transplant was done in March 2014 on a case of multiple myeloma under the unique leadership of Professor M. A. Khan in BMT Center, Dhaka Medical College Hospital. BMT Center CMH DHAKA started hematopoietic stem cell transplant in 2016. Since then, we have experienced 124 hematopoietic stem cell transplant on various indications. The first allogenic hematopoietic stem cell transplantation in the transplant history of Bangladesh was performed at BMT Center CMH DHAKA in 18th October 2018. The first hematopoietic stem cell transplant in pediatric patients also held in CMH DHAKA Bone Marrow Transplant Center at 2019. In 2025, we moved to non-hematological solid malignancy. This is 124 hematopoietic stem cell transplant, among which 80 cases was autologous hematopoietic stem cell transplant and 44 cases allogenic. In autologous transplant, we are experienced in multiple myeloma, relapsed refractory Hodgkin lymphoma, relapsed refractory non-Hodgkin lymphoma, neuroblastoma, and embryonal cell carcinoma. Among allogenic hematopoietic stem cell transplant, we have experienced in acute myeloblastic leukemia, acute lymphoblastic leukemia, very severe aplastic anemia, thalassemia, post-autologous stem cell transplant relapsed case of Hodgkin lymphoma. This pie chart shows among autologous stem cell transplant, 36% cases are relapsed multiple myeloma. In case of multiple myeloma, we selected the case who are in CR or very good partial remission, and we selected them for transplantation. In Hodgkin lymphoma, we selected for relapsed refractory case for multiple chemotherapy or chemoimmunotherapy, and these cases also held in classical Hodgkin lymphoma and nodular lymphocyte predominant Hodgkin lymphoma. Among these, the maximum cases is in the mixed cell variety. In 25% cases held non-Hodgkin lymphoma, both of cases are both B cell and T cell variety. Our maximum experience is with the DLBCL, but we also done stem cell transplantation in anaplastic large cell lymphoma, angioimmunoblastic T cell lymphoma, and also the mantle cell lymphoma. And this 4% belongs to neuroblastoma and embryonal cell carcinoma. Among allogenic stem cell transplantation, more than 50% cases held acute myeloblastic leukemia. In myeloblastic leukemia transplant cases, we always follow the ELN risk stratification criteria. Those who are in the high risk and intermediate risk group, we offer patient for transplantation after first year. But those who are in the standard risk group, we offer transplantation in the second year or later on. We have done the 4 ALL cases, which covers 9% of allogenic stem cell transplantation, 13 very severe aplastic anemia, which covers from 30% of allogenic transplantation, 3 cases of thalassemia, among them 2 is the thalassemia major and 1 is transfusion dependent T beta thalassemia, and 1 is Hodgkin lymphoma cases. This patient is transplanted in CMC Vellore, but after that patient relapsed and came to our center. As she had the 10 out of 10 mass sibling donor, so we offered her the allogenic stem cell transplantation, and now she is passing a qualityful good life. Among 80% autologous transplantation, we commonly used beam and RBM conditioning for Hodgkin and non-Hodgkin lymphoma, high-dose melphalan for multiple myeloma, high-dose cytarabine and high-dose etoposide, and carboplatin for embryonal cell carcinoma. Averagely, we use 5 into 10 to the power 6 C34 cells per kg for our autologous stem cell transplantation. Our duration of engraftment in an average for neutrophil 12 days and for platelet is 16 days. Mean transfusion requirement for autologous transplantation 1.5 units and for single donor platelet is 3 units. The events we faced for transplantation procedure is cytokine release syndrome, febrile neutropenia, culture positive sepsis, mucositis, diarrhea. Some of cases is suffered in organ complication, but they recovered very well by our contribution of BMT team. The average duration of hospital stay in our center for autologous transplantation is 16 days. This 16 days is started from the day of cell infusion. Unfortunately, we lost 4 patients during our transplantation procedure. 93.75% cases enjoyed the complete metabolic remission, and we found that 5-year overall survival in our transplant center is 90%. Among allogenic stem cell transplantation, in 44 cases, 39 cases has the full mass sibling donor, and 5 haplotransplant cases, the maximum HLA disparity is 5 out of 10. The 27 case has the compatible ABO donor, and 6 has the major mismatch ABO compatibility. And all cases are CMB reactive. And average we use 5 into 10 to the power cells per kg for transplantation process, and we are experienced in both malablative and reconditioning regime. And we for GVHD prophylaxis commonly use cyclosporin and methotrexate. Average duration of hospital stay is 28 days. Unfortunately, we lost 2 patients in our allogenic transplant, and one is due to veno-occlusive disease, another one is the steroid refractory graft versus host disease. 2 patients unfortunately developed primary graft failure. One of them is due to very severe aplastic anemia, and 2 patients developed secondary graft failure. Among graft versus host disease, 6 patients has the acute graft versus host disease, and 7 cases the chronic graft versus host disease. 95.45% patient enjoyed the complete remission, and we found 5-year overall survival is 93.18%. This is few disease-specific experience in stem cell transplantation. In AML, we use 26 patients we experienced for stem cell transplantation. Commonly used fludarabine, busulfan as conditioning regime, but we also experienced in fludarabine, tiosulfan, fludarabine, valprolan, cyclophosphamide, busulfan. Our common GVHD prophylaxis is cyclosporin and methotrexate. Besides the common events, we also experienced in transplant-associated thrombotic microangiopathy in 2 cases, BK virus-induced hemorrhagic cystitis in 3 cases, and post-transplant lymphoproliferative disorder in 1 cases. We are experienced in 4 patients for allogenic stem cell transplantation in acute lymphoblastic leukemia patients. All cases we used the TBI-based conditioning regime. None of these 4 cases experienced for GVHD or graft failure. All of them are passing good life. We have experienced in 13 cases for very severe aplastic anemia. Commonly used conditioning regime is fludarabine, cyclophosphamide, ATG, fludarabine, cyclophosphamide, and grapholol. Our GVHD prophylaxis is cyclosporin MTX. Only 1 patient developed a primary graft failure. This case is heavily transfused case, and this patient is still surviving with transfusion support. This slide shows the cost comparison between our center and the several centers of our neighboring country, and this slide shows the approximate cost for autologous transplantation is approximately 7 to 9 lakhs, and for allogenic transplantation we require approximately 4 to 60 lakhs money. Our center is open for all people. Every citizen are entitled in our center. This slide shows the 70% of our transplant cases is from the civil population. This huge proportion of civilians are getting the same service in our center and the same cost showing in the previous slide and maintaining the good standard of life. The stem cell transplant has many side effects and consequences like drug toxicities, graft versus host disease, and complication of immunosuppressive drugs. It is still the only curative option for many malignant hematologic and non-malignant hematologic diseases, as well as solid organ malignancies and genetic diseases. BMT Center CMH DHAKA is providing this curative management since 2016. Any patient to whom hematopoietic stem cell transplant is required can get every facilities from this center. We are also giving regular post-transplant follow-up and careful monitoring of patients, thereby saving our hard-earned foreign currency and playing unique role in national health sector. BMT team are working hard to maintain standard, quality and safety of care and ultimate outcomes in both auto and allo HSCT and keep it comparable with both national and international renowned hematopoietic stem cell transplant centers. We are also moving forward to start innovative cellular therapy and CAR T-cell therapy very soon. Now I want to share few pictures of our center. Smiling boy of DLBCL on his cell apheresis day. Second picture is the cell infusion. These two is our BMT team member, and this is BMT nurses with the stem cell after drawing. The smiling faces of transplant survivor. This picture covers only few of them. There are many transplant survivors. This picture is so precious for us because it holds our senior, their gracious presence, including our pioneer, Brigadier Hockmar sir, his relentless activities, his foresight and contribution makes our journey smoother. His unparalleled contribution creates the path for this BMT center through which we are working and making our center moving forward, and we are working for the, we are showing our, they showed our path and we are working on that path to make our center for moving forward. We are also thankful for our senior and generals who are extends their gracious hands for our center. And we are thankful for every member who are working relentlessly and to keep our center vibrant in every time, both inside and outside of our patients. When night becomes darkened, people are at home, our center remains open with every support for the successful outcome of our transplant patients. Thank you, sir. Thank you for your patient sharing.